Tip top of the day.
Good morning.
Good morning. This is I'm Lonnie Slone, Dr. Slone from Norfolk, Virginia. I'm a chiropractor. I've been practicing in Norfolk, Virginia in chiropractic for 36 years. This is Dr. Jason Kennedy, practicing in Richmond. He's been practicing for how long?
20 years.
20 years.
This is my 20th year.
That's a lot of years. So we're doing these videos. This is called Casual Conversation. And today what we're going to do is do a casual conversation about your neck. And we're here in at the Golden Horseshoe Golf Course. And this is one of the most beautiful places I've ever been to. It's one of my favorite golf courses in the United States of America. The grounds here are amazing. This is the birthplace of our country. Down the road is Jamestown. And anyway, he's on vacation here,
Right.
And so we're shooting a video.
Right, we're halfway between Norfolk and Richmond, so.
So, you know, we just finished a video about your back, and now we're going to talk about your neck. Suppose you're on vacation, and you just got here. You packed your bags, you packed your car, you carried your luggage, you ran through the airport with suitcases pulling down on you, and you wake up and you can hardly move your neck.
What do you do?
You got a stiff neck. You're on vacation. What's going to happen? So, I mean, you're going to ruin your vacation, right?
Right, that's not going to be any fun.
So, you know, I've actually seen that happen to one of my friends. We were out in Galax, and he woke up and had the worst stiff neck, and then he went to go play golf,
Right.
and
Got
he
a
hurt
crick
his
in my
neck
neck.
even worse.
Right.
And I mean, he was in bad shape. So, the first thing to do is not to panic.
Right.
And you know what usually happens when you wake up with a stiff neck is either you did something the day before, like you were carrying luggage and you pulled your nerves, or
Right.
you pulled your muscles.
And then you don't feel it till the next day after you sleep on it.
Exactly. Or you were laying in your bed and you got yourself into a funky position, and you were so tired that you didn't wake yourself up. And you were hurting yourself, but you didn't know it because you couldn't wake yourself
Right.
up. Then you wake up and it's, oh my God, I can't move my neck. I mean, it's similar to sometimes you put your arm over your head while you're
Yeah,
sleeping,
it's numb.
and you
Can't
can't
feel
even
it.
move your arm. It gets
Right.
stuck up there. So what really happens is, you know, a lot of people, oh, well, I pulled a muscle.
Right.
Well, you know, most of the time, it's not a pulled muscle. It's really hard to pull a muscle. If you think about when
Those
you lift
things
weights,
are in there tight.
yeah, you know, you lift weights, and to pull a muscle,
Right.
you'd have to have an under contraction, then it
Right.
would have to yank it
Right.
even farther
Right.
than it would normally go.
Maybe in major league sports, when they pull muscles, they might pull muscles.
Exactly right.
but
A tear,
typical-
like
right
a
there.
torn hamstring.
Right, right.
I mean, it's yow, it's
Right.
all of a sudden, it's bruising, there's
Yeah,
swelling
it's pretty
there.
bad.
And any motion against resistance causes productive
Right.
pain. You may have an inflammation from recurrences, overuse, and get a tendonitis or a myositis.
Right. But it's very difficult to totally tear the muscle.
Exactly. So most of the time when it really is joint related.
Right.
You basically slam those joints into each other, or you push the joints, or
Right.
you stretch the joints, or you shear the joints, and you created an inflammatory process. Actually, cells probably died.
Right.
And when the cell dies, the contents of the cell leaks out, and it causes an inflammatory reaction, and there's heat, redness, swelling, and pain. And
And then the muscles around the area don't want it to move, so they get tight, stiff, they go into spasm, and then here you are.
yeah, exactly. So you get this pain spasm cycle from the severe joint pain. So, you know, once again, chiropractic is a drugless healing art. We don't prescribe medicine. It's
We're
against
taught
the
how
law
to,
for to prescribe medicine. They didn't teach you to prescribe medicine. I don't know how to prescribe medicine, and I'm not prescribing medicine. However, you know, non-steroidal anti-inflammatory medication is advertised on television all the
Right,
time.
it's over the counter.
For the temporary relief of pain and inflammation. The Rand Corporation came out and said that non-steroidal anti-inflammatory medication is the best medicine. And non-steroidal anti-inflammatory medication is a great medicine. Advil, ibuprofen, Aleve. If you have any gastroesophageal reflux disease, if you have ulcers, if you're on blood thinner medication, if you're on high blood pressure medication, you know,
There's a lot
call
of
your
people who
doctor
can't take it, right.
or ask your pharmacist, because we can't tell you to take it, but it'll help you. Now, you'll get better without it, but it'll help you get better faster. And you know, the key is if people go to the emergency room and they get a prescription for non-steroidal anti-inflammatory medicine. They take one pill and that's it. You got to take it regularly.
Right, take it as prescribed.
It's 3 times a day or 2 times per day until it's done, because you want to imagine you have a smoldering fire and you want to put water on it and stir it up 3 times a day and make sure that smoldering fire goes out. You know, the interesting thing about neck pain and back pain is not so much the acuteness of it, it's that 4, 5, 6 weeks from now, did it go all the way away? Because a lot of these things don't go all the way away.
They become chronic.
And that's the big thing, is the idea here is to do everything you can do to make sure it doesn't become chronic.
Right. And what is chronic? Most people think chronic, well, I don't have it all the time. It comes and goes, it comes and goes. Well, that's chronic. If you're, you know, going 3, 4 months, you're having no problems, then all of a sudden you do something, it pops up, it stays for a week or 2, then it goes away for 3 or 4 months, then it comes back, then that is a chronic problem. And that's what you want to prevent in the first place.
Or chronic could be you have it all the time.
Or it can be all the time.
Some people, it never goes away.
There's always a degree of neck pain.
So, you know, if you have arm pain, numbness, and tingling, if you have some weakness, that's something you need to get checked out a little bit. And that could be nerve root irritation. So the first thing is ice. You want to put ice on that affected area. You make an ice pack. You put some ice in a wet towel. You can put it in a baggie. You wet it. You put it right on the affected area for 15 minutes. And the idea is to reduce the metabolic rate, to reduce inflammation,
reduce the swelling,
to numb the area, and then after you do that, you can do some stretching after that.
How long do you do the ice? 2, 3 times a day for a couple, 3 days?
You want to do it for 72 hours. You want to do it for 15 minutes. You want to make sure you don't burn yourself with ice. It's going to be cold, it's going to hurt, then it's going to get a little numb, and that's what you kind of want. And what we want to say once again is that if you hit your head on the corner of a desk, you sprain your ankle, you sprain your knee, you jam your thumb.
Put ice on it, not heat.
You want to put ice on it. You don't want to put heat. If you put heat on it, you're going to make it worse. You're going to make it swell worse. The ice makes it go down.
There is a time and place for heat, but it's not right after you do it.
So ice is a physical anti-inflammatory medicine, and non-steroidal anti-inflammatory medicine is also, it's all about reducing inflammation to restore function. So once you put the ice on there, then what do you want to do?
Then you want to start moving.
So
movement is your friend. We want to start moving the affected joints, the facets, and the muscles and tendons on that area.
So you want to start trying to get it to move. If it's killing you too bad, it hurts so bad you can't do it, fine. You don't have to hurt yourself. But if you try, if you bend it forward and backward 10 times, you turn it right and turn it left.
And the good thing with the neck is you can do a lot of passive type movement, because you can take your hand and just kind of stretch, where your back, that's more difficult to do. So you can kind of do it within the pain tolerant level. I mean, you don't want to make it worse, but the point is you want to start getting moving to whatever degree you can initially. And then once you start moving, it'll become easier to move.
Right, exactly. Because it breaks the pain spasm cycle. So so the joint hurts really, really bad. The muscles tighten up to splint it. Now you have muscle spasm because it's trying to protect the joint. So now you have this situation where you can't move. The muscle can't get stretched out. The muscle tightens up, builds up stored metabolites. It gets sore. It hurts. No blood gets through there. And now you got a mess.
Doesn't sound good.
So here's how you do it. You bend your neck forward and backward 10 times. You turn right, you turn left 10 times. You lean right, you lean left 10 times. You don't want to do neck rolls. Neck rolls may hurt the joint, jam the joint.
Not now.
These are all single plane tissue sparing exercises.
Left, right.
And you know, sleeping. You want to try to sleep on your back or on your side. You don't want to sleep on your stomach. Pillows. You want to try to keep your head straight. You don't want your pillow where it makes your head go this way. You don't want a pillow where your head goes this way. You don't want to sleep on the couch where your neck goes this way. You want to keep it in a state of physiologic rest. So passive movement, ice for 72 hours, non-steroidal anti-inflammatory medicine. A little massage won't help. Bengay or any counter irritant will feel good. Basically, it covers up the pain through the gate theory of pain. And that's pretty much it for acute neck pain. And hopefully that'll help you get through it. Most of the time it's not horrible, serious, amazing, terrible. Sometimes there's this thing called acute torticollis where the muscles tighten
Right.
up and your chin gets jammed to your shoulder. And even in that case, the treatment's pretty much
The same. It just may take a little bit longer to,
Right.
Those things don't go away right away. The torticollis sometimes can linger for, up to a couple weeks.
And remember, it's just pain. Now, I know that's kind of weird to say, but it's not, the pain is not going to hurt you. Your damage is done.
Right.
So the pain does not necessarily mean harm. You're not hurting yourself by moving your neck. And, today everybody wants to take instant relief and opioids and, okay, you want to be a zombie and lay down for the next 10 days,
and that's
fine.
getting more difficult to get, as well as the emergency room doctors and family doctors aren't prescribing it. So you're kind of you're left with exercise and movement and ice and over-the-counter anti-inflammatory. So getting the opioids, as we're realizing, that's not the answer. It's just causing an addiction problem in some cases. So it's you gotta stick with the ice and the movement.
And then if it doesn't go away, go see somebody, get an X-ray, figure out what the heck's wrong in there, and maybe there's some, degenerative disc disease, degenerative joint disease, or bone spurring or whatever. So anyway, we hope that helps you, and hope you're having an awesome day. And this is Lonnie Slone, Jason Kennedy. We're chiropractors, and we just had a casual conversation about your neck.
All right.
Have an awesome day.
Enjoying vacation.